Hi, I'm Kylie Berke. I'm a lifelong early childhood educator and someone who supports teachers and children. One of the many challenges that exists when it comes to addressing childhood trauma is the secrecy that often surrounds it. To move this work forward, we have to normalize talking about trauma and share our stories. Here's mine. I have no conscious memory of my birth father, although knowing what I know now about the physiological impacts of early adversity, I am certain that my brain and body remember. He was an alcoholic who physically abused my beautiful mother. She left him before my first birthday. She remarried when I was 5 years old, a lovely man who eventually adopted me and my older brother. When I was 6, my mother was diagnosed with cancer, and she died when I was 9. During those years, my adoptive father split his time between work and the hospital, and my brother and I were frequently left alone. For me, my early childhood teachers were my only constant. I had really long hair. It was so long that my little arms couldn't quite brush the middle, and I'd get these terrible, gnarly knots. So my teachers would brush my hair for me. Before the school day started and after the day ended, I would go and sit with one of these teachers and she'd work on the latest knots. And while she brushed, we talked. These women had a way of letting me express myself in ways that made me feel loved and nurtured and supported. My brother didn't have that support. He went through those years without the warm, nurturing embrace of a consistent, supportive adult relationship. Now, my brother and I were always different people, but we had way more in common than not when we were younger, and I adored him. We came out on the other side of my mother's death completely different people and would go on to take opposite paths in life. I did well in school. I liked it. I went to college. I became a teacher, a school administrator, a mother, an author, and a CEO. He did poorly in school, had difficulty concentrating, and often found himself in the guidance counselor's office for dramatic behaviors. People weren't talking about mental health back then. After graduation, he struggled to keep a job, battled with his health, and became a drug addict. A father who took his children in and out of homelessness. A few years ago, my brother died of a drug overdose. As I grew up and could reflect on our childhood with some adult perspective, and certainly as I studied human development and learned about the impact of early adversity, the key differentiator in our experiences was that I had these amazing women, these incredible early education teachers who quite literally saved me. Trauma has a disorganizing and detrimental effect on a child's learning and development, and it has long-term, wide-ranging impacts on their health and well-being well into adulthood. My brother is a perfect example of that. Over two-thirds of children will experience at least one traumatic event by the age of 16, and over half of children between the ages of 2 years old and 5 years old have experienced a severe stressor in their short lifetime. Exposure to these stressors have a negative impact on a child's ability to learn in school. I can think of children who I've taught. Casey, whose parents went through a contentious divorce with months of frightening screaming matches in the home. Living in a nearly constant state of fight or flight, he presented with behaviors in my classroom like flipping over tables, knocking down chairs, running out of the classroom. Georgia, whose chaotic and unpredictable home environment led her to develop the adaptive behavior of completely shutting down during any classroom transition, so she missed directions and was perpetually confused about what was happening. Joseph, whose young mother died of a drug overdose when he was 5 and left Joseph in the care of a father he'd never met before. He'd hide food in his backpack, sneaking discarded leftovers out of the lunchroom trash can, and would alternate from being the life of the party, the class clown, to being completely silent and lost in his thoughts. Children who've experienced trauma are more likely than other children to be in a state of fight, flight, or freeze, which leads to a cycle of dysregulated behaviors, poor relationships with their peers and with their teachers, and ultimately negative learning outcomes. Not to mention all of the long-term impacts on their physical and emotional health. But the great news is that research confirms my experience as a child. A trusting, secure, warm relationship with the teacher or caregiver can act as a buffer between the child and the negative impact of trauma. It can actually protect them, shielding them from the potential long-term negative consequences of exposure to early adversity. And in the short term, that relationship can help them to regulate their behaviors and build resilience. Well, I've had the honor of knowing and working alongside the folks at Adventist Healthcare, the Lourie Center for Children's Social and Emotional Wellness. The Lourie Center's comprehensive approach to supporting trauma-impacted children and their families is nationally recognized as the leader in research on best practices. Their efforts focus on prevention, early intervention, education, research, and training, working primarily with children and their families who've been excluded from mainstream preschool programs and school settings because of dysregulated behavior that stems from their exposure to trauma. What's especially remarkable is that we know with a high degree of certainty that what the experts and staff at the Lourie Center are doing works. Decades of extensive research confirms the impact of the Lourie Center's programs for trauma-impacted young children, including an 80% success rate in transitioning children to public school. Academic and social gains from their preschool program that last all the way up through second grade and beyond, reduced suspension and expulsion rates, and 75% of parents and caregivers report that their child is succeeding academically and socially 3 years after they've transitioned out of the Lourie Center's care. Thanks in large part to the work that the Lourie Center is doing, we understand how to create positive outcomes for trauma-impacted children and their families. By continuing to support their work, we can ensure that more children are provided with a buffering relationship, one that mitigates the short and long-term impact of children's exposure to trauma and has the potential to forever change the trajectory of a trauma-impacted child's life.